Athletic training is an allied health profession that is recognized throughout the United States as one of many pieces in the healthcare system. The NATA, National Athletic Trainers Association, defines athletic trainers as those who provide physical medicine, rehabilitative, and preventative services. Athletic training education programs are accredited by CATIE, which is the Commission on Accreditation of Athletic Training Education, and athletic training students must take the BOC, or Board of Certification exam, in order to become certified athletic trainers. Athletic training follows 5 major domains, which include prevention, clinical evaluation and diagnosis, immediate and emergency care, treatment and rehabilitation, organization and professional health and well-being. And within the athletic training education programs, they use a competency-based curriculum. Some of the historical perspectives of athletic training as a background. Athletic training curriculum began in the 1950s as a outshoot of physical education programs, but there were 2 athletic training core classes. In the 1970s, clinical education was added. In the 1980s, a competency-based curriculum was developed. And in 2010, the 5th edition of Educational Competencies were published. And also in 2010, there were over 350 CATIE-accredited athletic training education programs throughout the United States. But by the school year 2022-2023, there will be a move from undergraduate athletic training education to a graduate level program. 5 main goals of clinical education include authenticating student knowledge, interpreting theoretical and applied knowledge, developing and refining skills, familiarizing students with the workplace, and developing problem-solving and time management skills. Some of the educator traits and strategies that were found in research include the educators have multiple roles, including mentor, preceptor, teacher, and athletic trainer. And they also have various personal and professional values. Respect, caring, social responsibility, accountability, excellence, and integrity were some of the main values found in research. The majority of athletic training educators do have advanced degrees past their bachelor's degree. And some of the main strategies include building good relationships between the athletic training students and educators, where communication is key. Students must acquire the task of being active listeners. Educators must be patient towards their students while they're learning, and educators must also help facilitate critical thinking of their students. Some of the learning and pedagogic strategies include professional socialization, which is the process of acquiring and internalizing the knowledge, skills, values, attitudes, and norms of the respective profession, and service learning, which include local and international experiences in atypical athletic training settings, including clinics and low-income communities. Some of the assessment and testing found in research include immediate feedback, which was found to be excellent in use in lower-level undergraduate general education courses, but not as good in upper-level athletic training core courses. 5 general teaching strategies that were found include transmission, nurturing, apprenticeship, developmental, and social reform. Transmission is where students should be mastering their content. Nurturing, students should develop complex reasoning and problem-solving skills. Apprenticeship is where students will perform meaningful tasks in real settings and improve their professional socialization. Development is where students will have positive attitudes and academic persistence. And social reform changes the way students think about professional activities or issues. Some of the testing methods include case studies, scenarios, authentic experiences, including laboratory courses in clinical education, and a positive educational environment. The competency-based curriculum has 9 main domains, which include evidence-based practice, prevention and health promotion, clinical examination and diagnosis, acute care of injuries and illnesses, therapeutic interventions, psychosocial strategies and referral, healthcare administration, professional development and responsibility, and clinical integration proficiencies. This curriculum can be covered in standard lecture courses, laboratory settings, or at clinical sites. and they are meant to bring students as close as possible to the real-life duties of a certified athletic trainer, in addition to fully preparing them for the BOC and for entering the workplace. Some of the future research and implications include effectiveness of competency-based curriculum at the graduate level, changing teaching methods for older students or higher expertise, improvement of the BOC pass rates due to change from undergraduate to graduate level ATEPs, and more accurate rankings of athletic training education programs based on more than just the pass rates of the BOC.